Welcome back. You're watching a special edition of the MedFiles program, and we're talking about robotic surgery. We have in studio Dr. Ajit Saxena, a visiting urologist from New Delhi, India, and Simon Caro from Pathway International in Nairobi. So before we took the break, we were talking about this fascinating technology.
Yes.
So the other thing that would want to know is, so we've heard all these great things about it. So when can we get it in Kenya? When do you expect that we'll be able to have it here?
Okay, let me say this: we can definitely access it. Any Kenyan who needs it and who would want to choose or opt to get this procedure done can access it now. The world has definitely become a small global village. So if somebody would love to go and get it done or needs to get it done, then they can contact us and we can be able to organize the whole trip to go and get the surgery done.
In India?
In India. February 5th is actually World Cancer Day. And one of the reasons actually the Da Vinci robot, we're creating a bit of hype about it, or just discussing it and beginning to introduce it to Kenyans, is doctors all over the globe, all over the world, are converging actually to the Apollo Hospital to do, we can say, a medical camp using this machine. So there is a great rate, great discounts that they've offered for this procedure, which I think when I compare them to a laparoscopy procedure, they're very similar, specifically for February. So if the Kenyan wants to go now and get a prostatectomy, as well as other surgeries that can be done by the Da Vinci robot, then they can access it now. When will it come to Kenya? I believe sooner rather than later. But the first thing we need to do is definitely develop the skills of the doctors.
I see.
It's like getting the cart before the horse. Which one do you get first?
The car before the driver.
Yeah. Well, I mean, the car won't be able to drive itself.
Yeah.
Right. So one of the things we want to do is develop the doctors, work with the doctors, develop that skill set. So when that machine comes, it's ready to go. Key, ignition, start it, let's go. So Pathway has partnered with the Apollo hospitals and providing an opportunity for doctors, if there are doctors listening and are interested in going to Apollo, we've partnered with them to provide actually a free training for doctors to go and experience this, to go even with their patients, be able to have a hands-on experience using this fascinating technology.
Yeah. Absolutely.
Yeah.
All right. So you say this technology has been used where you're based, in India. Where else in the world is it being used?
See, this technology started from the United States of America. They have now got about 240 robots all over the country, the maximum number. And India, it has just come into the market, so it will slowly develop. But even now, we have about 48 robots in the country.
In the whole of India?
The whole of India. And slowly it's going to come up even more. Other countries that have taken the lead is Israel. In the South American continent, it's been there. But there's still a lot of scope for robotic surgery to come through.
I'd like to add our southern neighbors also have got it, South Africa.
South Africa.
Oh yes, there's one in South Africa.
There's one in South Africa, yes.
All right, so would be the first in the region?
We would definitely be the first in the region. So the scope of people accessing it in East, Central, North Africa is amazing.
Right.
Yeah.
Interesting. Now another question that one of my colleagues asked is the issue of power, because it's an electric device. So the first question that anyone would ask is, supposing there's a blackout, supposing the power disappears, like happens a lot in Kenya.
That's a very intelligent question, Mariam. Because in our countries, both India and Kenya, there are at least 5-6 interruptions during the day, if not more. And what happens in this robot is got a computer in it, which actually judges the number of times the instrument has been used. And that depends on switching the robot off. Once you switch the robot off, it counts it as one use. And when you switch it back and again, and if this happens 2-3 times, then it becomes the surgery becomes surgery will become very expensive. So it needs a very big UPS system, a backup system which is absolutely essential in our countries to keep that at bay. It's powered by the normal electricity and it does the purpose.
Right. So still with electricity, these are metallic instruments that are going into a human body that is water. So how do you deal with
80% water?
Yes.
In what sense? I didn't get
in terms of like you have this is an electric device that is running, and it's still coming into contact with the human body, which is 80% water.
Not really. It's the machines that are that get the electrical supply. The rest of it is directions from the console to the robot. That is not electricity dependent. But to work out the whole system, or the light cable, the light to be given to that, the diathermy, that is electrical connection. And that's a very small part of the whole thing. So what I'm saying is that electricity is required, but where it matters, we don't use electricity. Only time we use it if we actually want to burn the tissue, and there is a foot pedal for that, which a surgeon, and unless he presses the foot pedal, it won't work.
It won't need it.
Yes.
Okay. So you're saying it would be safe, or what sort of regulations would you need to ensure that, we've had cases in one of our local hospitals where there were actually cases of deaths because of power cuts and power surges and things like that. So then how would you say, as the company that would be bringing in the machines, ensure that there won't be these lapses?
Oh, it is a big check before the machine is put to use. And as I said, where it matters, the electricity is not being used. It's being used indirectly to provide the light that comes through, to provide the energy source. For that it's required. So really the patient is very safe. Nothing's going to happen to the patient. Even if the machine, there is a short circuit in the system, that's only at the machine level, and there is a complete system which locks out everything. So there are a lot of safety checks in this.
And those safety checks definitely will come in before licensing of the machine, ensuring before it's put in, there's obviously the licensing, making sure the facility has the capacity to handle that machine, so the machine can be put anywhere. So there's a lot of steps before that machine is put into place. Making sure you have the required backup systems, whether it's a generator, inverter, etc. So those regulations definitely would come into play before that machine is placed in a facility. And as we bring it to Kenya, I think those regulations are things that would be worked on and put on paper before just plug and play.
It starts to be used. So who would be the body that takes care of those regulations, or makes sure all those things are in order? Like you're talking of licensing, what sort of licenses would be required, and who would be, who would be the prefect to ensure that all that is done? Can we?
We would need a robotic board, but right now we have the medical practitioners and dentist board who license health facilities all over Kenya. So before any facility is sanctioned as a health facility, there is that they have a paper on the wall that says we've been vetted, we've gone through the checks and balances, and we're good to go. That's very important. So obviously that sort of system would be implemented, and even for simple things as laboratories, there is the laboratories board, pharmacy and poisons board. That's what I'm saying, we need robotics and poison boards. We'll create employment for Kenya. We'll create one and maybe create employment for more Kenyans.
I tell you what can happen with these robots is that there can be mechanical failure. We're giving directions from here, the robot refuses to accept it for whatever reason in between. It's been mentioned theoretically, but up to now we haven't noticed it anywhere, globally anywhere. But that is a possibility that can happen. The answer is simple. You just convert it into a laparoscopic procedure and carry on. So a patient is safe.
Either way. Okay. So we talked of there are some downsides, like you've mentioned one.
Yes.
What are the other downsides that?
Well, we've mentioned too, the cost also is a problem at the moment. Hopefully it will come down as more and more robots come and have their use. There is one big problem that it comes initially in the learning curve, and that is that there is no tactile sensation. When we use our hands to touch the tissue, we get a feel of the tissue. Here, it's because at the long end of an instrument, we do not get a feel of the tissue. So you could be digging in very hard into the tissue and not know. The other thing is when tying the knots, you don't know how much strength to give to the knot. And initially what happens, you try with all your might pull this thread and it just snaps. Because there is no communication between the hand and the suture that you're doing. One has to get used to it through experience, and that can be overcome. But that's one of the big problems, the tactile sensation. There is a lot of work being done on that respect, and hopefully within the near future we'll find something
somewhere around it. But
So
this, like what you're describing, that there isn't, that a doctor will not be able to know how much, say, pressure to put when tying a knot.
yes, it comes through experience that this much pressure you apply for tying a knot this tightly, or you want to make it more tight. It comes through experience.
But either way, if say a doctor doesn't apply enough pressure or is pressing too hard on a tissue, what's the worst case scenario? What's the worst that could happen if a knot isn't tight enough, or if the pressure on a tissue is too strong?
Yes, if not securely fixed, it will may come off, and if it's on a big vessel, that may result in bleeding. But like I said, it's a little bit of experience. It works.
It's fine.
I think the robots will become more intelligent, and as you said, they'll be able to feel. And maybe a disadvantage is if they begin to think too much. I watch science fiction when robots take over the world.
Redundant. Okay.
Yeah.
So you mentioned that this surgery is used mostly for urological procedures, the prostate cancer.
Not many urological procedures. And when we started with the robotic radical prostatectomy, but now we are doing cystectomies, we are doing PUG obstructions, we are doing kidney operations. More or less, wherever laparoscopy was being used, the same area this robot can be used. But that's in urology. And I know what you're going to ask is that what other specialities?
Yeah, where else can it be used?
Yeah. So we can use it in general surgery, and one of the good operations is for reduction of fat. The operation is done for reducing the fat by tying up the stomach and all. Is brilliant with the robot. It takes only 5 minutes to do it, which normally would take about 1.5 hours. And then there is a use in gynae for the hysterectomies, for removal of fibroids.
Yeah.
It's all going to come up in
So that's not being done yet?
It's being done.
Okay.
These are the other uses where we can use the robot. Our robot is multi-speciality. That means all the specialities can use the same robot for their purposes. ENT is another place where it's got a large role to play.
Okay. So are there surgeries then that this robot can't be used for because either they're too sensitive or because of just the morphology of the body, say for heart surgeries?
Some cases it's not required, so therefore there's no point in using that. For instance, laparoscopic cholecystectomy, the removal of gallbladder, is beautifully done with the laparoscope. To use a robot is being spendthrift. But you mentioned about the cardiac. It's very interesting because initially this robot was developed for cardiac purposes.
So there isn't a surgery that is too sensitive?
But the problem with cardiac operations is that one vessel goes in front, one by the side, and one from the back of the heart. Now the back of the heart is very difficult to reach with the robot. So all you can do is harvest the vessel and then open up the heart and do a beating heart. Now for all that, to have a robot with such expenses is not on, and more or less cardiac has been given up and fell into the lap of the urologists to start doing the prostates.
Yeah, but like you're saying, it will widen.
It will widen, yes. The other limiting factor is that the instruments have not been developed for all kinds of surgeries. So as more and more instruments are devised, the indications will also improve.
I think right now there's something still better done by humans. and there's some things better done by robots.
Mm-hmm.
Yeah, and it will take a while before a robot can do some things better than a human being.
Mm-hmm.
And that goes to anything in life. Human being can never be replaced.
Yeah.
Yeah.
I think that's quite right, actually.
Mm-hmm.
It's the man behind the machine, as you said.
Yes.
Yeah, it's
And,
the machine that matters.
right.
So this.
But I must tell you that robotic surgery is teamwork. No one person can claim to be a robotic surgeon.
Mm-hmm.
I have my own team, and they all have a slot where they are supposed to work.
Yeah.
If that person is absent, then I'm in trouble,
Mm-hmm.
because the next person doesn't know. Simple thing like changing the instruments, you have to be with a clockwork precision. So the team is very important. To get the right persons in the team, it makes a lot of difference.
Mm-hmm. Right. So this big, wonderful machine, who's making it? Where, or who made it? Where is it from?
There's a company called Intuitive,
Mm-hmm.
because they are multimillionaires now. But when they started, they didn't have money to buy the robot from NASA.
Mm-hmm.
So that's how they started.
Mm-hmm.
Probably took a loan or something.
Okay, so it's an American company.
It's an American company, yes.
I see.
And they have the sole rights globally
Mm-hmm.
till 2016.
After which, what happened?
Well, I think the Chinese will come up.
Chinese will make one of their own.
Yes.
Everybody will start making them. After the patent, everybody will be able to make them.
Tell me about the patent.
The patent gives you sole rights for that product. You're the only one who can make it. You're the only one who can get profits from it.
Mm-hmm.
It's similar to what Kenya introduced for the music.
Yeah.
The musicians had patents. They brought it recently. You can't play this song. So the musicians needed to be paid. It was the original song.
Yeah.
You can't just play it anywhere without paying for it. So the music industry introduced the music patent. So Matatus had to pay a certain fee so the musicians can get their money. But this is in the Western world, it's huge. You invent something, you get rewarded for that.
Yeah.
So Intuitive is now reaping rewards immensely for designing and inventing this magnificent machine. Yeah, so right now it's them. Eventually you'll start seeing other brands, like we have different brand clothes, shoes, so forth.
So they retain the patent until 2016.
Exactly.
After that, anyone else can pick it up.
And you know the Chinese, they do everything. They do everything. Yeah.
They've probably got a machine around the corner.
Yeah.
Yes.
Probably in the next, once the patent is over in 3 to 3 months,
introduce one of their
half
own
of the
day
cost.
after that. All right. So what else? What other huge technologies do you see coming up? Because it's something like this robot is something that would